Hello and welcome to the very first episode of Health Nuggets 2021, where your health matters. Now, January being Cervical Cancer Awareness Month, we thought it wise here on Health Nuggets to join the world in creating awareness about this condition that is said to be amongst the leading causes of death in women. We've all probably heard of cervical cancer, but on today's show, our focus is on the diagnosis of cervical cancer. Now, how does the doctor conclude that one has cervical cancer? What are the symptoms that they look at? And what are some of the tests that are done to conclude that one has cervical cancer? Once again, thank you for finding time to join us, and Health Nuggets starts now. Well, welcome to today's show, and as I said earlier, we are looking at cervical cancer, focusing specifically on the diagnosis of cervical cancer, of course, January being Cervical Cancer Awareness Month. And we are at Janice Cancer Hospital, and I'm joined with Dr. Aurora Maranga, who is a gynecologist, oncologist. Welcome, Dr. and thank you very much for joining us on Health Nuggets today.
Thank you. Thanks for inviting me.
Okay, Dr. let us set the stage for our audience. How does cervical cancer come about? And what are the signs and symptoms that one should look at?
Thank you for inviting me to your show, and thanks for visiting Janice Medical and Cancer Hospital. You're most welcome. Now,
thank you.
When you look at cervical cancer, it's actually known to be caused by a virus, and that virus is called human papilloma virus, generally abbreviated as HPV. So HPV has been known and proven to cause cervical cancer, and it is sexually transmitted, and it causes changes in the cervix, but most people would generally eliminate it from their system, and it doesn't cause cancer in majority. In fact, around 95% of women who get HPV, they eliminate it from their system. The problem comes in with the 5% where the human papilloma virus, that particular virus which causes cervical cancer, where it now persists in their system. When it does persist in their system, in the cervix, then over the years, it may cause changes which may culminate into cervical cancer. It may take anything between 5 to 15 or even 20 years from the time of infection to the cancer developing. And that's important because then it gives us a lot of time to screen for it and to discover it very early before it actually becomes cancer which can affect life as such. And that's where the screening methods come in, the Pap Smear come in, and vigilance, that's where it actually come in. So human papilloma virus, the virus which is sexually transmitted, is the one which does cause eventually cervical cancer. In terms of signs and symptoms, cervical cancer really, very early, it has no symptoms. And that is really, it's a good thing, but it's also a tragedy in the sense that one may think they're okay until when they start having symptoms, in which case then it's a bit late. And that's why the screening is emphasized. Screening is generally done when somebody doesn't have any symptoms. However, some of the telltale signs that things are not right in a lady, the following one could be vaginal bleeding, abnormal bleeding. If it's a younger lady who may notice that the periods are abnormal or doesn't really know when the periods were, so has spotting on and off, has unusual periods or unusual bleeding, bleeding which can occur maybe after intercourse, or bleeding which may come when they are opening bowels or when they are straining, doing any other activity. That type of bleeding is a telltale sign. And for the older women, those who have gone through menopause, they start having bleeding, which sometimes they start wondering whether they're becoming younger and they're getting their periods again. And in our setup, that's a big issue, especially the older women when they start having bleeding. And it's more like a taboo subject. So they get embarrassed about it. They don't even tell their children or even their friends. And it gets discovered late. We find ladies coming to us, women coming to us, old lady coming to us, and they've been bleeding for over a year or even 2. And they haven't really gone to seek any attention. So bleeding is one of the main ones, but there's also discharge, basically abnormal discharge from the private parts. Often it is watery, often it is smelly. And the other symptoms, one could have low abdominal pain, a bit of backache, but all these are symptoms of now an advanced disease. So what I would encourage women to do is basically go for screening of cervical cancer annually. When you don't have symptoms, don't wait for symptoms. And if anybody has those symptoms, then they should actually go to hospital to be checked whether it has to do with cervical cancer. It may as well be something else, an infection or otherwise. Yep. Okay.
So you've talked of the HPV, okay, and the human papilloma virus, that is. So there's the HPV vaccine that is to be given to younger girls, I believe 10 to 13 years. So let us just talk of the vaccine, because of course cervical cancer is preventable and treatable. So let us just look at the HPV vaccine.
Yeah, we do have HPV vaccine. It's been there for the last, it's now almost 15 years, going to 15 years. It's been proven to work. In some countries like Australia, New Zealand, which embraced countrywide vaccination of their young girls and later boys, they're actually aiming at elimination of cervical cancer in their countries in the next decade. So they've done a lot of strides in that particular regard. In our country, we still do have the vaccines that are actually available, although they're not fully funded by the government. I understand there is, under the Ministry of Health, a program to roll out the vaccination, HPV vaccination, to the schoolgirls. I think it has started but hasn't really picked up so well. But efforts, I believe, are underway for that. So the vaccine, yes, it is safe. It has been tried. It's not being given only to our girls in Kenya. It is worldwide. In this country, it's also available in the private hospitals, and something which we encourage, especially before sexual debut. That's why it is given in the early age. Just like we usually would give measles vaccines or polio vaccines in childhood to prevent future infections and afflictions for those infections. So the same thing with HPV. We give it early before sexual debut, although I should hasten to say that it can still help any woman who doesn't have that particular type of human papilloma virus. It can still be preventive. Yeah.
Okay. So as explained earlier, today we are looking at the diagnosis of cervical cancer, and you're right here at Janice Medical Center. And we have Florence, who is our patient, and you are also joined with Daktari. And basically we're just going to look at the diagnosis. So we are talking of Pap Smear and cervical cancer diagnosis. So Daktari, thank you so much. Maybe you can just explain the scene, like what our audience are seeing.
So straight to the point, I'm going to show you what is generally required when we do Pap smears. There are several ways of screening for cervical cancer. The main one, which I think people usually hear about, is Pap smear, which I'm going to explain, but there are also other screening tests, like this one we call visual inspection with acetic acid, or visual inspection with glucose iodine. Those ones are where a lady would usually be lying flat, and the clinician, the doctor, the nurse will actually visualize the cervix, put some reagent on it, and from the appearance of that cervix is able to tell whether the cervix is normal or whether it needs further investigation, generally called via VILI for abbreviation. So I'll talk about Pap Smear. What is generally required is a speculum. This is a speculum. And usually we'll also require a lubricant. And this is what we call the Pap Smear kit. The Pap Smear kit, by and large, allow me to, I'm basically contaminating them so that to illustrate, but it's a sterile, clean procedure. So this is the brush which we will generally use on the cervix. So if you could kindly focus here, this model, this is the uterus. Of course, these are the ovaries, and the cervix is this area we are talking about, and this is the birth canal. So the speculum, once we lubricate it, is supposed to open up the birth canal so that we are able to visualize, the cervix. Once we have visualized it from outside here, then the nurse or the doctor will actually use this brush on the cervix like that, and then go around collecting the cells from the cervix. I may do that like 3 or 5 times, and then it will take the cells from there, transfer them to this particular brush. And then after that, this brush is brushed on a glass slide. There's a glass slide here. So we brush it there like that, gently. And then after that, there's some fluid on inside here, which we use to pour on top to fix those cells. And then after that, we wrap it up. You generally cut it like this. And those cells which are already there, we cover them like this. And then this is what we write the patient's name and the particulars, and this is what we send to the lab. So the pathologist is going to process this under the microscope and then give us a report after maybe 2 or 3 days whether the cells are normal or whether the cells are abnormal. Depending on that is when our decision is made if there's abnormality in terms of what needs to be done next. So in brief, that is how Pap Smear is done. So it is a simple procedure. It's not painful. It may be a bit uncomfortable. We use a plastic gadget, which is not unduly uncomfortable.
Okay, so once you've taken the samples, I'll say, so how long does it take for the results to come out?
Around 2, 3, 5 days, depending on the lab.
All right. And let's talk, of course, we are Kenyans, and there'll always be myths and misconceptions about every procedure. So for the Pap Smear, what are some of the, or maybe one myth that you've heard maybe ladies talk about, and that's the reason as to why they fear coming for the procedure?
Yeah, one of the commonest myths I hear about is that this procedure is very painful. And women will talk about this gadget, it's called a speculum, that it's painful to insert, which maybe is because of the previous technology where it used to be metallic. That's what used to be there, but nowadays it's plastic with a good lubrication really, and the lady is relaxed. It's not a painful procedure. And there are many a times when I've seen women come, they're very anxious that it's going to be very painful. We do the procedure and they're like, was that all? I mean, they're still waiting for pain to come because of misconceptions. And then at the end of the day, it may be a bit uncomfortable, but look at the bigger picture. Here we are trying to prevent a killer disease, cervical cancer, which you want to catch it early. Once you catch it early, then cure is almost assured. Yeah.
Okay, so we are with Florence, who is a cervical cancer survivor, and she's just going to share with us her experience and also talk to us women outside there who could be scared of going through such procedures, and just tell us how important early screening of cervical cancer is.
Niko hapa nikiwa cancer survivor wa cervical. Nilikuwa diagnosed 2013 na nilipatikana, sikuwa naenda screening. Kwa hivyo 2012 ndio nilikaa na breeding. Hiyo breeding ndio nilikaa naye more than 7 months. Paka wakati iliisha ndio nikaenda screening. Juu singefanyiwa hiyo Pap Smear kama na breed. Wakati nilienda nikafanyiwa hiyo screening, sikuenda yani nikaenda hospitali nikaambiwa nitaenda nifanyiwe Pap Smear. Nikaenda Kenyatta Hospital Clinic 66 na nikatolewa Pap Smear, nikatolewa biopsy. Ile ilirudi kapatikana iko na cancer cells stage 1B. Na ningependa sana kusihi wa mama wote wawe wakienda screening, wasipuuze vile mimi vile nilipuuza. Juu wakati umepatikana ikiwa early, unaweza tibiwa haraka. Juu kama ningepata hata nafasi ya kwenda hospitali na nitolewe hiyo nyungu ya mtoto, singeenda hizo kemo zote zile ile nilienda vitu mingi sana za kutibiwa. Kwa hivyo kwenda early screening, ukipatikana kama uko naye tuseme 1 hivyo, hizo utatolewa nyungu ya mtoto. Kwa hivyo ningesihi hata wasichana wawe wakienda screening. Juu msichana kama hajazaa na patikana na kansa ya cervical, hatapata mtoto. Juu atatolewa hiyo nyungu, hatapata mtoto. Kwa hivyo wamama hata nao wasihi wasichana wao wawe wakienda screening kulingana na vile daktari anataka. Nao wale wako na wasichana, watoto wadogo, wakubali kuwapeleka vaccine. Hapo tutasaidika sana kama wamama. Juu hii safari ni refu sana ya cancer.
Na kuna akina mama wengi na wasichana pia kule nje wanaogopa procedure. Wengi wanasema ni uchungu, wengi wanasema hawataki, na vile umesema hiyo ndio huwa tunajua kama tuko na cervical ama kama hatuna, na pia inasaidia daktari kwa matibabu. Wewe utawaambiaje ile siku ulikuwa unafanyiwa hiyo procedure, wewe mwenyewe ulisikiaje?
I think mambo imekuwa digital. Kulingana na vile daktari amekuelezea. Hii gadget ya digital haina uchungu kama ile ya zamani. Kwa hivyo watu wakubali haina uchungu. Na madaktari wanajaribu kuangalia wamama sana. Juu hiyo akiumia hata bado familia yake itaumia. Juu huyo mama akona bona. Kwa hivyo wanajaribu kuangalia sana. Wakubali kuenda, haina uchungu. Waende mapema na wakubali kuenda kulingana na vile daktari anasema after 6 months unaenda screening, na hapo tutasaidiana.
Asante sana.
Asante.
Yeah, so on this side you can see there is another gadget. This one is a microscope, as you can see. Medically we call it a colposcope. It's a microscope. So once we've done the Pap Smear or we've done the other screening test and it shows that the cells are abnormal, then we want to find out, to diagnose. what the extent or the severity of the problem, how serious is the issue. And at that particular time, we need to do a biopsy. A biopsy is when you take a representative tissue, representative small tissue from the cervix. And we don't do it blindly. What we do is we use a microscope. So there would be women who have probably done Pap Smear. They're told it's abnormal and therefore it needs to be checked further, to be investigated further. In that instance, then is when they are referred here for us to do colposcopy and biopsy. What this instrument does is we repeat the same scenario where we look at, we position the patient, and then we are able to look at the cervix using the same gadget. And once we look at the cervix, then we focus this microscope. Okay, and once we have focused this microscope on the cervix, there are some reagents we put on the cervix, and then we are able to look at the cervix using this microscope. And what it does is to magnify the cervix, the cells of the cervix, and then we are able to know and to see which areas on the cervix are abnormal. And that is where we take a small sample of tissue from the cervix. That one is also taken to the pathologist now to tell us what's the significance of the abnormal Pap Smear. Then based on that, we are able to know whether it is cervical cancer or it's not, or it's early stages of cervical cancer. From there, then we decide whether we need to do surgical procedures, or if it is an advanced type of disease, then we can discuss other possibilities like the chemotherapy and the radiotherapy, but that depends on the stage of the disease. But most of the time we use a microscope for the very early, suspected very early stages, because I mean, if you can't use a microscope for something which is obviously there. So this is for very early suspected cervical cancer.
All right. Thank you so much, Daktari.
Karibu. Yeah, so it requires total privacy. So we are going to close the curtain so that you're able to do the procedure. And of course, we would have taken a consent earlier on. So thank you very much. I'm going to close and then we continue.
Well, so we leave Daktari at it together with Florence, who is the patient. But as you've heard, Florence was declared cervical cancer free. However, she has to come for the frequent checkups. So we've also heard that it's not a painful procedure. So it's something that you and me can come, because early screening, of course, saves life.
Niko hapa kama cancer survivor wa cervical cancer. Ningependa kuambia wamama wote katika hii Kenya wawe wakitembelea mahospitali zao for screening ya cervical. Juu ukishajulikana mapema unaweza tibiwa kwa urahisi, lakini ikienea sana itakuwa gumu kwa madaktari. Kwa hivyo screening ni ya muhimu. After every 6 months unarudi kwa daktari, anaenda na kufanya screening. Na sio chungu hivyo wamama wanafikirianga. Prevention is better than cure.
Fact: cervical cancer is real. Fact: cervical cancer is preventable. Fact: cervical cancer is curable when it is caught early. Fact: cervical cancer has no symptoms in very early stages. Fact: cervical cancer screening saves lives. Fact: cervical cancer Hpv vaccination prevents future cervical cancer cases.
Well, I hope that we've all been enlightened on cervical cancer, and as we've heard, early screening will always save life. So let's take it a personal responsibility to always go for screening after every 6 months. Thank you very much for finding time to join us on this episode of Health Nuggets. My name is Aida Munzati. See you again next time, but always remember that your health matters.